There are instances when a broken tooth has to be removed and an implant has to be placed. So traditionally, you would remove the tooth and do a bone graft and send the patient home for 4 or 5 months, and then have the patient come back and do a second surgery, and sometimes you do a third surgery. But with modern implant techniques, we don't have to go through 3 surgeries. Rather, it's only one surgery and there are no cuts or stitches. You numb the patient, remove the tooth atraumatically with special instruments, and you don't disturb the gum around it. When you remove a tooth, you get a socket. Through that socket, you drill a hole and you place the implant, and then whatever empty space is left, you put bone graft there, and on that implant, you place a fixed temporary crown so the gum maintains its arch-like character and doesn't shrink, it doesn't collapse. So when the final abutment in the crown are made, it looks very, very natural. It's very hard to tell if it's a prosthetic tooth or it's a natural tooth. So the beauty that comes out and the engineering that comes out of this immediate implant protocol is unsurpassable. No way close to the mediocre results that come from the traditional implant technique.